If you experience this when you get out of bed, then you could be dealing with plantar heel pain, or more commonly known as plantar fasciitis. That classic first step pain when you get out of bed, or if you've been sitting too long and it gives you that pain at the bottom of your heel. Well, yes, that's plantar heel pain, and it could be associated with an inflammation to the plantar fascia, or maybe not. When it comes to plantar heel pain or plantar fasciitis or whatever title you want to put on it, it really doesn't matter. There's a few concepts that I always want to cover with my patients in the clinic. One of the most important value adds that I bring to my patients is education. So if you want to get the most education, make sure you stick till the end of this video, and I'll share you the underlying secret if you've been having this type of pain for years and it's just not getting better. There's a few general concepts that go into play when it comes to treating this type of heel pain, and it always starts with deloading and modifying activity to some extent. That doesn't mean that you're going to lay in bed and do nothing, because that's not realistic, and ultimately that's just going to make things worse. So we want to reduce load, reduce stress to that area, and calm it down, right? And there's different ways you can do that. Different ways, everyone responds a little differently. Then we want to promote some blood flow and a nice healing environment to that tissue and the surrounding tissue, whether that's with some dry needling, some scraping, some gentle soft tissue work, whatever it might be, just to manipulate that environment and promote some blood flow. Okay. Once we do that, we want to correct the impairments that are in and around the foot and probably up the chain, whether that be at the knee and at the hip, right? So we're going to go up the chain to look at what's tight, what's weak, what are you missing, okay? Because at the end of the day, there's been a disconnect of load management and the foot is paying the price. So we're going to correct those impairments. And then once we do that, we're going to reload the tissues through the foot and the rest of the leg, but definitely through the foot specifically, and including the plantar fascia, including the other tissues on the bottom of your foot that need to stretch and move and accept load appropriately to get you through walking and jumping and running pain-free, okay? So if you're doing this consistently, it's going to take weeks for that adaptation to occur. If you're doing it, it should get better. You can stretch, right? You can wear a splint at night. You can tape. There's other methods that you can apply to kind of manage your symptoms. But ultimately, if you really want to get to the root of the problem, you need to do these other things.